So welcome today. We're here to talk about the word, in a sense, life-saving. We're hearing it all the time, life-saving, life-saving. It's not something new. Mine action has always meant to be life-saving. Reduce the casualties, reduce accidents, save lives. What was particular is that it was thought to come after conflict ended. And we are seeing very clearly from the last 3 days, I don't think I really need to remind this, mine action's role does not wait until after conflict. We hear Gaza, Ukraine, Sahel, the list goes on. And so we have put together this event to talk about how we don't have the luxury to wait. So my name is Caitlin Hodge. I am the Global Technical Quality Manager for Mine Action Activities at HI, and I'm also the focal point in case of emergency responses for the Mine Action Department. And I'm going to be moderating this side event today. It will be split into 2 parts. The first part is on emergency preparedness, and the second part is on emergency response. Although I do recognize that this is not always so strictly linear, and there will be overlaps between preparedness and response. Now, we have a lot to cover in a very short amount of time. This is deliberate, short interventions to match the rapid pace of emergency responses. So each panelist is going to provide really a brief overview into their corner of the emergency preparedness response spectrum so that we can map the whole landscape, not just all of the mine action pillars, but also the links with other sectors as well. There is a trade-off. This may not leave time for questions, so I apologize in advance for that. But what I can say is if you're interested in continuing the discussion, I'm happy afterwards to link you with any of the panelists where you can discuss further. So my aim is that when we finish, we'll have a clear sense of the priorities, challenges, and the practical entry points for engaging in emergency contexts. So we'll start with the first part on emergency preparedness. Our first speaker is Colin Bent. He will be speaking about anticipatory actions for contexts experiencing armed conflict. He's a global special advisor for conflict preparedness and protection, or CPP, with Norwegian People's Aid's Mine Action and Disarmament section. Based at NPA's Global Training Center in Sarajevo, he's the thematic lead for the organization's CPP programming and provides technical support on risk education to NPA's country programs worldwide. He currently co-chairs the Emergency Risk Education Task Team under the ERE Advisory Group together with HI. Over to you.
Is there a clicker? Or?
Yes.
Great. So good morning, everyone. My name is Colin Bent, and thank you very much. I'm happy to be with you here today. I'm glad that we're here to talk about humanitarian mine action interventions as anticipatory action, as something that we do not just after a conflict or emergency breaks out, but as something that we can do before a conflict or emergency emerges so that we can have greater impact and save greater lives. I only have a few minutes to talk to you today about my area of mine action, which is conflict preparedness and protection. And it's really important to note that conflict preparedness and protection, which aims to mitigate the risk of harm from explosive weapons and other conflict-related risks by raising awareness and promoting behavioral change regarding preparedness, safety, and protection measures, is best implemented before conflict or escalation breaks out. By planning and implementing CPP risk education prior to the outbreak of armed violence, anticipatory CPP can help to ensure that communities, households, and individuals have taken critical preparedness actions before conflict risks arise. In this way, anticipatory CPP before conflict helps build community resilience to conflict shocks through improved community awareness and safer behavior. Perhaps the most basic challenge we face, however, is that it can be very difficult to determine when a conflict is going to break out, where it's going to break out, and how it's going to break out. So how can we anticipate then where we're going to implement. This is a very difficult thing in advance. In some contexts, it's fairly easy. NPA, for instance, implemented CPP in the immediate aftermath of the 2014 conflict in Gaza, and we implemented CPP risk education right up until the current conflict that began in October 2023, all with the anticipation that further escalations and a large-scale conflict like the one that we just experienced these last few years were possible. It was inevitable. In some contexts, it's not so clear where a conflict or where an emergency might break out. So this is part of our challenge. CPP contributes to the safety and preparedness of individuals, communities, and households in at-risk communities, and all through promoting and disseminating core risk education safety messages, which can have to do with emergency planning, understanding the effects of explosive weapons, whether that's blast, heat, fragmentation, secondary fragmentation, and the threats that those pose to people's health and safety. The risk mitigations that they can take in the home in order to mitigate the risk of harm, selecting and preparing a safe room, preparing a stockpile of emergency supplies, preparing an emergency grab bag, gathering and maintaining key documentation in case you must evacuate, preparing children's emergency contact cards so that if they become lost or separated from the family, they can be reunited with their family much easier. Preparing for the needs of people with disabilities, very important because once a conflict breaks out, and if you have not looked after the needs of people with disabilities, their specific needs, it may be that they are, it's very difficult for them to cope under those circumstances. We also teach or train about the warning signs of attacks and knowing how to take cover and where to take cover. And we combine this, of course, with explosive ordnance risk education in order to have a cohesive package. It's really important to deliver this before conflict so that all of these preparedness actions can be taken by civilians before these risks occur. Once conflict breaks out, it's often too late for civilians to take many of these actions and learn about how to practice them. Challenges, we have a number of challenges. Conflict is often a sensitive topic in many countries, a political phenomenon, so we often have to do a lot of liaison with government, a lot of work in communities in order to get acceptance from the public, acceptance from national authorities, acceptance from other actors, in some cases non-state armed groups. And we're always worried about or having to think about public perception and reception. If you're going to implement CPP and warn people about the things that they need to do in order to prepare for conflict, many people might say, okay, what do these people know that I don't know? Is a conflict about to happen? Are you saying this is certain? We don't want to frighten anyone. We don't want to raise fears. So we need to program accordingly and do community liaison. There's often lack of capacity on the ground, and often funding is only available or mainly available once an emergency breaks out, not before an emergency breaks out. So these are some of the challenges that we face with implementing CPP and risk education before an emergency arises. But some of the opportunities are beyond being able to have maximum impact before an emergency arises. We have quite a lot of existing messaging and materials from different programs that other programs can, or other contexts can adapt and use. We have a number of contexts where national ownership has been, where ownership of CPP activities has been taken on by national actors, LMAC in Lebanon, INGD in Mozambique. There's a number of good examples of government taking this on and facilitating it before conflict ever arises. Of course, we have lots of synergies with other kinds of activities, whether that's emergency equipment distribution, first aid training, early warning systems, shelter construction, other kinds of mine action activities. All of these are good activities to integrate CPP with. And we have a community of practice. We have the Emergency Risk Education Task Team. We have the CPP Subtask Team. A number of different fora where people who are CPP practitioners are gathering to share information. One of these fora, one of these newly established bodies is the Early Response Network for EORI and CPP, or the ERNI. It was announced on Wednesday and at the plenary. And the idea is to create a dedicated, agile mechanism, a group, a coalition of organizations that have expertise and resources for conducting and supporting EORI and CPP in emergency situations, and being able to come together and provide rapid technical support, specifically in cases where a new onset crisis might arise in the world in a context where there may not be any existing capacity, whether that's national capacity or maybe some of us as operators are not present in that country. In this case, the ERNI would jump into action and try to react and support local capacity on disseminating EORI and CPP. A big piece of this is anticipatory action, so making sure that we're monitoring potential conflict environments in advance, we're tracking the possibility and risk of escalation, and that we're identifying partners in these locations, in these contexts that we can support and leverage to disseminate EORI and CPP as an anticipatory action. Thanks a lot.
Waiting to see if the practice emerges that we clap for everyone or that we go on. Seems unsure. So thank you so much, Colin. Our next speaker is Dr. Anna McKean, and I think it's important to remember that not all emergencies are due to an ongoing conflict. Sometimes the violence ended years or decades ago, but a new type of emergency brings things to the surface. So Anna McKean is a senior advisor on mine action and environment at the Conflict and Environment Observatory in the UK. She joins us to talk about mine action and anticipatory action for climate-related hazards. Dr. McKean is a specialist in integrating environmental safeguards into humanitarian mine action and assessing war damage to the environment and biodiversity using open source intelligence and Earth observation. She holds a PhD in environmental sciences and policy from the Central European University of Hungary.
Thank you very much. Thank you, Caitlin. Thank you. Good morning, everyone. I will give a bit of different perspective. I will talk more about environment, climate, and mine action. If you're looking in the news, we can see more and more information how climate extreme weather conditions happen all around the globe and how it influence mine action and the communities where we work, or if it's a sea level rising, or droughts, or floods, landslides. In the center we have the flooding which happened in Ukraine after Kakhovka Dam was destructed. It was man-made catastrophe, but it also influenced the minefields that were shifted, the mines and other exploded ordnance were shifted down the stream. So why it is important to look into the climate change, especially in the communities that are vulnerable. We know that 60% of 20 countries most vulnerable to the climate change, they also have the contamination of exploded ordnances. And we, as a mine action operators, organizations working in this field, we need to think about it. And there are three ways how mine action and environment interlinks. The first link is that existing environment influence the work of mine action operators and the communities. If for example, if you need to clear the battlefield or you work in the mountains, that environment influence the methods you use, the approach you take in there. The other way, which is important to understand and remember, is that how mine action operators influence environment, and which methods and what we can do to mitigate that the impact on the environment and to return land to people in a better condition. And sometimes like the remediation measures could be very, very small and things to be do very small, but we are able to return land in a much better condition and like help communities more than just provide safety and security. Of course, for mine action, safety and security of people is the most important, but we can think in a bit longer term what we can do to make the life of the communities where we work better. And the other link is a changing one. It's like, for example, how climate change influence mine action activities and how it can change the working approach for the operators. And on the next slides, I will talk a bit in detail that actually how different climate-related impacts influence the work of mine action operators. If you look at the higher temperatures, winds, dust storms, intense rain. This does influence the explosive ordnances, the deterioration conditions and stability. It also impacts the robustness and durability of the equipment mine action operators use. It can cause heart-related illnesses because higher temperatures to work for people is really, really hard, and there may be some more things you have to do to help your operators, your people, your staff to work in these conditions. You need more breaks. Sometimes shifts can be shorter, or people start working at 3 a.m. in the morning, not to be under the sun. Then you have a stand-down time. Sometimes it can be up to 25% of the time, and you cannot go to the areas to work. And then you need to report to the donors, what are you doing during this 25% of time? How are you using this time? And also we know that for mine detection dogs, they can't work for the temperatures above 30 degrees. So there's also like stand-down procedures. Then we have land fires. Land fires can trigger the detonation of explosive ordnance, or the other way, the detonation can cause land fires. It's a risk to staff. Need to have additional equipment, need to have additional trainings, evacuation plans, medical equipment and other stuff you need to think about. And this is the issues that countries face in many countries. We know in 2024 in the southern of Ukraine, NPA Ukraine and Halo Trust who are working in that areas, they really suffered from the land fires there, which were caused by the conflict. Then we have flooding and landslides that we know about the movement, possible movement of explosive ordnances, but also important to remember the movement of the marking territory. The marking signs, they move as well, so you don't know exactly where you can go, where you cannot go. Then it adds additional work to the mine action operators to do more survey, to do possible more clearance, stand-down procedures, and many other delays. I know that in PA Bosnia, when they have flooding and landslides, they use their time to rebuild the roads or do some other things to help the communities during this hard time when you cannot get to the areas to do demining. Then droughts. This increase pressure on the water sources, on the local communities, and the NPA, if they build the whole camp, any operators, when they build the camp and use water resources for them, they can take more water from the local communities. Impact on the soils, also stand-down procedure, and sometimes when you have a drought, the explosive ordnance that were under the water, now they come to the surface, and you have to deal with them like hotspots right away. And also, we know that due to the climate change, we have a shift of the climate zones. So they become hotter, climate zones moving up, and then we have more diseases that are not common for one areas, and you need to prepare for that as well. And I can see that I need to stop.
Perfect timing.
Yeah, thank you. I just want to say that with EORE that operators go to the communities quite close and have a chance to talk with them, and it's a really good point to include this emergency messages and help them to prepare for possible climate threats as well, or to help them with the water management, to know how to store water during the wet seasons, how to use them in the future. But this is some kind of educational opportunity that operators have and use. Thank you very much.
Thank you very much. So I think those are really important points, and something we've been trying to do is to overlay the explosive ordnance open source data that we have of incidents with conflict-related DRR data, and then we pre-position emergency ordnance risk education materials there. So there's a lot, I think, to tap into on that side. So the role of donors in all of this is, of course, crucial, fundamental. So here to speak from the perspective of the donor is Zoe Poznicek. She's in charge of the Mine Action Portfolio in the Swiss Federal Department of Foreign Affairs Peace and Human Rights Division. In this position, she coordinates the various actors in the Swiss government working on mine action. She covers the multilateral portfolios in relation to the Mine Ban Convention and the Convention on Cluster Munitions, and she implements the Swiss Action Plan for Mine Action jointly with the Department of Defense and the Swiss Development Cooperation. She previously worked for the United Nations Office for the High Commission for Human Rights, as well as for civil society organizations.
Thank you so much, Caitlin, and thank you so much for having me on the panel today. It's really great to speak to you. I don't have a presentation, so I will speak from my notes. I hope that's okay. From our perspective as donor, but also as sort of diplomatic actor, we understand that mine action is on its own life-saving in emergencies, but it also plays an enabling role for all other interventions that we're trying to implement in these situations. And here we understand that the realities of funding cycles is so that often priorities are set far in advance, and also the administrative processes that allow us to actually disperse the funding, even where it falls within those earlier set priorities, can sometimes take a long time and create a blockage to the entire system that goes from, I mean, we see mine action really as an enabler in these situations, and if mine action can't intervene, it will also delay other interventions in these areas. So I have a few reflections, and I think Switzerland does a decent job in being a relatively responsive donor, but of course there is room for improvement. I have a few reflections on how funding can be more responsive when it comes to emergencies for mine action, but of course this also applies beyond mine action to other areas. The first, I think, and this is probably the ideal case, is flexible funding. Providing organizations with ideally core funding, or some donor colleagues have started to provide regional funding for situations where access might be difficult in certain emergency areas, but to allow them to prioritize as much as possible these areas, but otherwise use the funding in other spaces as well. So regionally flexible funding is a good practice. Of course, there's a little bit of a conflict here, because as donors we also like a little bit of control of where our money goes. So this is just a reality that we have to grapple with. We are accountable to Parliament, to our taxpayers. They set ultimately the priorities for our funding resources. So there's limits to how flexible we can be with our funding. But I think the essential point is that our partner organizations, once we build a level of trust, the more trust there is, the more flexibility we can provide them in the funding. So this is a long-term process. The longer we engage with a partner globally, the more we can build flexibility into our funding sources. For us also, sometimes the proposals are very specific, and then we realize on the ground this is not possible, or it's not actually the most effective thing. And here we really encourage our partners to just reach out to us as donors early, as soon as they realize this, so that we can adjust. We're often very flexible as long as the communication happens before. It is a bit difficult for us if we then only learn about the changes made in the final reports, because it puts us in a difficult spot, right? We're happy to make those adjustments early. The second part where I think donors can play a role is in increasing the availability of funding in emergencies, is in improving our coordination among donors. When we are coordinating, I think especially on a global scale, it allows us to make sure that every region or context that has mine action needs receives at least some basic funding, or some organizations that are present there. And once the organization is present, they're much more able to responsively increase and scale up their activities. Some partners have called us children on a football court. Everyone is running after the ball, running after the new hot crisis. And I think there is a reality to this that also again comes from our broader priorities that we need to serve with our funding resources. So coordination is not a magic bullet that will make funding become available for places that don't have funding, but it can allow us to increase or at least understand who is already present where is it just a drop in a bucket, and where is it actually essential and can provide for the continuity of programs. And we are trying to do a better job at this. You might have heard of the Mine Action Support Group, which is a global donor coordination forum. We're also trying to implement this in a context-specific level, increasingly for individual contexts. And the third point on this, I think, is anticipation. It kind of ties into what Colin mentioned, but more while crises are ongoing rather than before the crises emerge. I think often during crisis, it's very hard, when the crises are acute, it's very hard to fully implement mine action. And whether that is because of safety considerations or because of access questions. We have a lot of contexts where access is just not possible for mine action for political reasons or for other reasons. We all know that mine action requires a lot of, or is an area that has quite a lot of government control often because of the import of certain goods that can be considered dual use, etc. So trying to anticipate when those windows of opportunity arise so that at that point funding is available is really crucial. And I think, in a sense, we saw this last year with Gaza after the ceasefire, that suddenly, although it remains limited in access, there is now a possibility for mine action operators to do some mine action work, although, again, we're not talking about EOD yet at this stage, but we're working towards that. And to make sure that those windows of opportunities are actually used and that mine action operators are able to use them, it's important that we, as donors, also try to anticipate where they will present. This means that either starting funding quickly once the windows open, or even maybe before the windows open up. This is a certain risk for us, and here again I think flexible funding can play a big role in alleviating this risk. This anticipation also needs analysis. We don't always have the expertise of what mine action means in every context as donors, so we also rely on our partners, and for Switzerland we work very closely with GICHD to understand sort of how the mine action sector is impacted by these questions on the ground. But also, of course, our other partners who are already present in the area. And this kind of ties into my last point, where I think as donors we don't only have a role to play to provide funding, but also to connect these conversations to a political level and a diplomatic level. Sometimes it's difficult for mine action operators to bring those conversations to the authorities because they risk their relationship with them. And here, as donors, as governments, we can play a role in bringing those messages at the political level, in trying to alleviate this access, in creating those windows of opportunity. And again, here, we have been trying to do this more in a coordinated manner to align key messages. Of course, we will not necessarily always be able to speak with one voice because we have different priorities, but we at least to have a common understanding among donors and be able to bring those key messages together to the government that we are trying to work with and trying to support through mine action. So I think that's all I have to say. Thank you so much.
Thank you very much. Thank you for highlighting how donors can enable emergency responses and also the real constraints that you face. So this is the halfway mark, so I'm going to ask the panelists to swap places. And meanwhile, I'm going to set the scene. So we've been doing our best to prepare, but now this is it. It's happening. An earthquake has struck, or maybe the rockets have launched. It is time to react. So our first speaker in the second part of the panel is Peter Muller. He is the head of the Operational Support Unit in OCHA's Emergency Response Section, which manages the UN Disaster Assessment and Coordination Mechanism, including UNDAC partnerships and environmental emergency response. He has been working for over 30 years in humanitarian assistance, disaster risk management, and crisis prevention, in particular for MSF, UNDP, and since 2008 for OCHA. In this current capacity, he has led emergency response missions to 11 countries, including the response to the earthquakes in Turkey and Syria.
Thank you, Caitlin, and glad to be here. Thanks for having me. When I checked in this morning for my badge, I was the first person from OCHA. So before I start, because I was going to introduce OCHA quickly, maybe a little interactive moment. Who is aware of OCHA? Oh, okay, that's not so bad. All right. Okay, there will be a second interactive moment coming up. Yeah, so I'll talk a bit about OCHA. I'll talk about UNDEC and our relations with HI Atlas Logistique in the area of mine action. So OCHA is a department or an office of the Secretariat of the UN. We have the mandate to coordinate international humanitarian action and affairs, right? And so we are now, after the cuts, about 2,000 people worldwide. We lost about a quarter of our staff because of the financial crisis. And as you know, the humanitarian reset is happening in that sense as well. Our key functions are basically around coordination of international humanitarian assistance, advocating on behalf of affected people in terms of their protection and their vulnerability and of course, life-saving issues. We also coordinate the humanitarian financing in the humanitarian architecture. And of course, we have a role in humanitarian policy development. Coordination of the humanitarian action really goes at different levels. Obviously, global levels, General Assembly, Security Council, interacting with member states, but also at country level with humanitarian country teams and UN country teams, and with the Interagency Standing Committee partners also at country level, bringing that often together in around response planning, humanitarian financing, humanitarian country teams, etc., clusters, of course, and then also very much at the local level, right, where emergencies happen. So that's in a nutshell about OCHA. I'm going to talk a little bit about UNDEC as well, the UN's Disaster Assessment and Coordination Mechanism or System. Again, a little show of hands, please, for my sake. Who's aware of UNDEC? That's already a little bit less, but still good to see there's some awareness. All right, so UNDEC, the United Nations Disaster Assessment and Coordination System, is basically the UN's rapid response mechanism for sudden onset or escalating emergencies. Right? So when there is a request, we are able to send out a team very quickly within 24, 72 hours that is made up of specialists, a humanitarian action specialist, a disaster management specialist that can work as a team in filling gaps in the coordination of a response. So this is traditionally very much focused on sudden onset responses, natural disasters. But we also deploy in conflict areas where there may be a natural disaster or where there's an escalating conflict. And the team, as it is trained, is able to fulfill the mission objectives in that sense. And it's based, of course, on a request from either an affected government or the UN system in country. So that 24/7 capability we have through a roster and through about 30 plus years of experience. Which is captured in methodology, standard operating procedures, handbook, etc. And so it's really to fill gaps in areas of response coordination that are basically have emerged because of the shock event. Right? So this can be support to government agencies that are responsible for disaster management or in the general humanitarian coordination. So think about the coordination of international search and rescue teams, urban search and rescue teams, supporting WHO in the coordination of emergency medical teams, general information management support to either the UN side or the government side, assessment and analysis, civil military coordination, environmental emergency expertise we can bring in through specialized partners, logistics, etc., etc. So really that gap-filling ability to also, of course, support the coordination, but also to enable responders to do their work and to have access to to affected people, and as well as affected people having access to humanitarian assistance. And so this access, of course, can be because of the weather, the landslide, the floods, but also bureaucratic impediments, whatever, customs, immigration, you name it, you're probably all aware of it. So that is quite relevant. So in that sense, I think I'll talk a little bit about the link with humanitarian demining then. So Atlas Logistique is one of those partners that we have worked with over the last couple of years. We have a number of partners from government agencies, for instance, the International Humanitarian Partnership, which is a consortium of Nordic, European, I must say, civil protection agencies. We work with MAP Action, we work with ACAPS, UNICEF. So basically partners that can provide us with logistics capability or assessment and analysis, situation analysis capability. So we've worked with Atlas Logistique already as the arm of logistics arm of HI for several years on the area of logistics, and increasingly also in terms of analysis. And so this is sort of how this started. We saw that our missions, I hope it's not a trend, but we saw a number of missions that also took place in areas of conflict or with related to mine action. For instance, we had a mission in Equatorial Guinea where there was an ammunition dump. I'm not sure if that's the right word, but it exploded anyway, so there was lots of ordnance there. We had the mission, of course, in Libya with the flood in Derna that destroyed the city. We had, of course, the earthquake in Syria. The blast in Beirut. So examples from where we also deployed a team, and we realized that one of the gaps we saw in our own capability and response was around the sort of demining awareness and all that. So we did not embed that in the team. We could not embed it in the team, and so where that was the case, we saw that we had actually sort of slower analysis of the risks of access. So that was one. So the risk analysis in general was incomplete. And we also had increased exposure, of course, for populations and for responders, not only our own team, but also for that facilitating role. So we had discussions with HI, Atlas, to facilitate that. So basically we saw that for the first time in Myanmar, when we could then deploy a mine action specialist, I guess, to be a member of, to be embedded in our teams. And that basically, of course, gave us capability in risk analysis, so more quicker, quicker exposure analysis for assessments, for instance, identification of high-risk zones. We also have, of course, the environmental component where we, for instance, can look at dam breaks in case of floods or earthquakes. And so there may be a mine action issue there around, particularly in those kind of situations in Myanmar. So identification of high-risk zones and providing advice on safe access routes for the response, either for the responders that go there, or of course for affected populations that need to access assistance, and being able to prioritize that. And then we, of course, also, that enabled us also in our coordination function and in our coordination meetings to do some education on explosive ordinances for responders that could then also, of course, be transferred. 1 minute? Yeah. So for us, it was clear that this is an extra capability. And so we are, of course, now have to institutionalize that. And yeah, it's for us, it's really something that we have now as an extra capability, that if we do a quick, at the onset of a disaster, when the request comes, when that is an initial identification of a potential risk or a capability that we would need to have, we can immediately basically call upon our partner Atlas Logistique, HI, to embed that in our team. So this can be a small team, as we see, of, well, at the moment we have a mission in Micronesia of about 4 people, but it can also be a big emergency like in Turkey, Syria, or in Myanmar, or in Mozambique recently, you know, where we send out a team of 20, 30, 40, 50 people and have that capability. So let me stop there. Thank you.
Thank you very much. Thank you for representing from OCHA at the NDM then. Yeah. So our next speaker today is Katarina Templeton. So sticking along the theme of coordination, but really focusing on the mine action sector and how explosive ordnance disposal experts, for example, can be enablers of a whole humanitarian response. Katarina is the Humanitarian Coordination Officer with UNMAS, and she's also the coordinator of the Mine Action Area of Responsibility for the Occupied Palestinian Territories. She has more than 12 years of experience in the humanitarian sector, including 9 years in mine action and program management across complex contexts such as the OPT, Ukraine, and Myanmar.
Thank you, Caitlin. And I think it's my pleasure to be here today and speak after OCHA, because I think it's very much linked and will complement on the example of how actually we coordinated the sector in context of Gaza. So when we are talking about Gaza context, I think it's important to understand why coordination was so important and critical there. So what you need to know, those who are not familiar with the context of Gaza, is that we have very much ongoing hostilities, though, for example, now we have ceasefire and we had the previous ceasefires, but it did not mean that it's fully the strike stopped. We still have pretty much intense fighting on the ground. We have widespread destruction where we have more than 81% of all the buildings are destroyed, fully or damaged. We have high level of displacement where people unfortunately been displaced not even once or twice, sometimes more than 5 times. We have high humanitarian needs. We had cases during the winter time of people malnutrition when the food access was very difficult. We had and still have severe access constraints where we do not have entire access to entire Gaza Strip. We also have extensive explosive ordnance contamination. Yes, we cannot name the exact extent, but what do we know and what we already seen is that, unfortunately, the amount is unprecedented, and we can judge it by the numbers of the victims who've been injured because of the explosive ordnance. Now we already have more than 1,200 recorded in our system, and we know that this is very much underreported at the moment. So when you have the conditions like that, so coordination, as Zoe mentioned, is probably not the solution, but it's definitely work in the context of the emergencies. And why it is important in the context like Gaza, but many others would follow the same pattern, is we have competing priorities on the ground. It's very hard to judge. Should we bring in food first, or should we repair the pipelines? Should we build a school or shelter for people? So when we do not know where the priority lays, and everything seems priority, coordination needs to fill in. And this is where we can deliver the comprehensive humanitarian help to people and actually make sure that no one left behind. We have a lot of actors who have their areas of expertise and their areas of the priorities. And without the coordination, it's impossible to also help people effectively. So when we have coordination in place, we know how to complement and deliver this coherent and comprehensive emergency aid to the people who are affected by the conflict. And also, of course, in the light of the current resources which are available, it affected Gaza as well. So how are we going to prioritize? Whether we need to prioritize food security and provide the money for the food for the people on the ground, or actually we need to provide first mine action operations on the ground to make sure that this food is actually delivered, because the roads may be mined. And then, of course, the coordination, make sure that we are kept accountable towards the people who we are assisting. And then the security constraints which we have when we are moving in a coordinated approach, it helps us to also access the area which sometimes is not accessible. So we actually, in the Gaza context, we're collaborating with OCHA a lot, and they're helping us in the deconflicting the areas and make sure that we are getting the access. So maybe to talk a bit more into details why the coordination worked well in Gaza, I can say it did. Because we had, apart from the partners who were willing to coordinate and the donors who were willing to support us, we had UNMAS together with the Humanitarian Inclusion providing this platform of the mine action area of responsibility. So where UNMAS stepping in as a provider of the last resort, providing the technical support, making sure that we have standards in place, making sure that we can prioritize and task operators. We can provide a high quality, making sure that everybody working according to the international standards, collect the data and provide this data, operate with this data. Mine action area responsibility, we provided this platform where we also managed to integrate mine action into other sectors, which is mean that to talk about effective coordination, we needed to start talking about mine action in the day one of the response. And then also advocacy, when we talk to the donors, when we talk to the different stakeholders, making sure that mine action is not forgotten, because sometimes we are thinking about the different priorities, food, which of course, if the people are hungry, we cannot talk about mines because the people are thinking about food. But then ultimately, when we are talking about any other sector, mine action need to come first to enable this critical support to people. And then also resource mobilization, when we are advocating that the part of the funding goes to mine action immediately to make sure that the rest of the areas can implement their activities as well on the ground. And then, so what really helped and what really worked in Gaza is that we had amazing partners who really were willing to help us to coordinate and support us in any initiatives on the ground. They kept flexibility. They came up with the different approaches. Yes, we are not implementing the classic mine action. We still have difficulties with disposal, for example, of explosive ordnance, unfortunately. But partners came with the technical expertise from the different angles and came up with the approaches which we can implement and still enable the other humanitarian help. We set up the comprehensive IM system on the ground, and also we kept in mind that we are building all our response on the humanitarian principles, which in the conflict like Gaza, which is very sensitive, is important. And I know that I'm restricting time, so I will go very fast now. But yeah, we aware that mine action, to deliver comprehensive mine action, we need to talk about all 5 pillars. But maybe to save a bit of time, I will talk about the enabling component, exactly to complement what my colleague been talking about. We provided the explosive hazard assessments, which is basically where the EOD technical people going on the ground, making sure that the roads are clear, or the some site is not contaminated to, for example, build a shelter or to build a tent or open the school. And now more recently, we are talking about early recovery, though, of course, with the ongoing hostilities, it's a bit blur context and blur line, but we started to implement the physical damage assessment when actually we also are making sure we can tell to our colleagues from UNDP who are working on the debris removal, whether this building or that site is safe to start removing the debris or removing the building. And of course, all these interventions, they're complementing to everything, to any other sector, and saving, this way it's saving lives and helping to rebuild future. And yeah, just maybe some statistic to show, yeah, that I mentioned, we unable to maybe dispose the items, but still we could say that 45% of the areas which we did assess, they were considered low risk, which meant we were able to give the space for any other sectors to start implementation of their critical humanitarian help. Thank you so much.
Thank you very much. So I'm going to move quickly. We have 2 speakers left. We'll go approximately 2 minutes over, so I hope you will be patient, but I'm going to keep it to that. So I think something important to say is that tragically we cannot prevent every accident. There will be casualties. So Dr. Hannah Wild is a resident surgeon based out of the University of Washington. Her work focuses on improving local casualty care in low-resource conflict settings with an emphasis on victims of explosive or injuries, and she's the founder of the Explosive Weapons Trauma Care Collective. Due to surgical commitments, she could not join us here in person, so she has pre-recorded her presentation.
My name is Dr. Hannah Wild, and I'm the director of the Explosive Weapons Trauma Care Collective, or EXTRACT. Thank you for the opportunity to present on emergency trauma care for explosive ordnance victims as part of this panel on VA and emergencies. Victim assistance in humanitarian mine action has historically been heavily focused on long-term rehabilitation, given the far-reaching ramifications of explosive injury, not only physical, but also psychologic and socioeconomic. While this is all critically important, improving emergency care for EO victims is equally important, and opportunities are being missed in this domain. Those who have seen me present before may have already seen these 2 graphs, but I think these casualty curves depict very strongly the gap that I'm talking about. The data in this graph show the case fatality rate, essentially death among injured patients rate, among U.S. military fatalities during the U.S.-led war in Afghanistan. And you can see that despite the fact that injury severity on the top increases, meaning casualties are sustaining increasingly complex and severe injuries, the case fatality, or essentially death rate, decreases by about half to 8.6% over a period of 8 years. In contrast, these are data from the Landmine and Cluster Munition Monitor, which show the case fatality rate among civilian EO victims. Not only is it 38%, many times greater than 8.6%, but it hasn't decreased in decades. To address this gap, we came together and created EXTRACT. EXTRACT is a multi-sectoral initiative, a volunteer working group composed essentially of experts in health and protection, and our mandate is to reduce preventable death and disability among casualties of explosive injuries. We focus on local casualties in low-resource conflict settings and post-conflict settings. So how to do it? How to go about reducing preventable death? Well, in the first graph I showed you, among military casualties, that reduction in the case fatality rate was brought about by a series of coordinated trauma care advances through what eventually became the mature joint trauma system. And while it's true that for local casualties in local health systems in low-resource conflict settings, many of these solutions will not be feasible, either at all or as designed, as an overall conceptual map, this holds a lot of value. And so at EXTRACT, we've essentially taken each element in this chain here, everything from bystander first aid to damage control resuscitation, a term I probably don't have time to define, and other life-saving measures, and taken a look at what would be required to adapt and implement them in a context-appropriate way for our target setting. For a whole host of reasons, the adaptations required are significant. First, the population, the patients and victims, are not only healthy, young, military-aged men, but women, children, pregnant, the elderly, persons with pre-existing disabilities or other medical issues, and resource constraints, of course. There's rarely helicopter aeromedical evacuation, more typically what you see on the top left, animal-drawn cart or other improvised means. And these resource constraints persist at the health facility level as well and pose dramatic changes to how we would implement the solutions devised. Despite these challenges, there are many opportunities, and I'll present just a few examples here. So one element in the military trauma system is called tactical combat casualty care. This means that not only medical personnel, but all service members serving in a combat role are trained in basic life-saving first aid. Well, we can absolutely do this in our context. And this is one of the areas in which we've leveraged the networks and expertise of humanitarian mine action by combining explosive ordnance risk education with layperson first responder training. So these are photographs from our first pilot project conducted in Burkina Faso. This was done in partnership with MAG and local authorities at the Ministry of Health and National Arms Control Commission. We have 30 local trainers who have by now trained hundreds of individuals in their communities. It's been resoundingly successful, and we have an open access toolkit both for contextual analysis, needs assessment, implementation, and evaluation, and we are in the process of scaling this in a range of other settings. Another key initiative of the Joint Trauma System was its clinical practice guidelines, abbreviated as CPGs. And these have been described as the backbone of its clinical performance improvement program. Essentially, these guidelines are designed to reduce variability in practice and provide clear instruction to providers who, in deployed and austere settings, may be providing care that's outside the scope of their standard practice. While the military CPGs are an extremely valuable resource, for all the reasons I mentioned, a number of adaptations are required for our target setting. So at Extract, we've taken this on, and we have a library of forthcoming CPGs. What's special about these is A, all of our author teams have equal or greater representation from local providers in low-resource conflict settings. B, we take into account the demographics that are affected by EO in conflict, including children, women. And 3, we take into account a wide range of resource constraints, both in terms of materials as well as personnel, because we all know that in many conflict settings there may be few doctors left. Either they have fled or been killed by targeted attacks, and care can be provided by anything from medics to clinical officers. Everyone always talks about data, and everyone always gets tired of talking about data, but as in other domains, it's true for trauma that without registries, it's extraordinarily challenging to understand where the greatest needs are, where the greatest opportunity for impact is. And it's often said that the constraints in these environments are essentially prohibitive to have high-quality data. Our team in Burkina Faso, you can see on the left, it was a heavy lift with boxes and boxes of anesthesia logs and surgical records, but we've created another toolkit for casualty data collection, which is also open access, and with that, published the largest casualty data set that exists in low-resource conflict settings, nearly, actually slightly over 1,400 casualties in Burkina Faso over a period of 4 years, and we hope that the tools developed during this process can be of use in other contexts. And
so in the interest of time, I'm going to end that one there. But if anyone is interested in seeing the final slides, just get in contact. So as our last speaker, I have asked my colleague, Fanny Haddery, to join us. She is a global conflict transformation specialist for HI, and she has over 18 years of experience working at the nexus of security, development, and conflict transformation programming. She lives in Chambéry with her 3 children, and I think it's really important that we do just even briefly touch on the importance of conflict sensitivity and especially do no harm. So she's going to talk about how to do that in an active conflict setting.
Human behavior, that's perfect for just a few minutes of time. So conflict sensitivity in mine action is how we're able to, of course, respect our mandate of doing no harm, but also that makes us more efficient. We've been able to prove, for instance, in areas in Colombia that although we were given a lesser amount of square meters, we had a higher rate of found EOs, and we were able to directly link that to the quality of our community liaison. So being conflict sensitive is not just doing no harm, but it's also being more efficient. We work with people, and in cases of emergencies, the line gets very blurry between how we work with the people that we employ and how we work with communities. Within armed violence reduction, 98% of our colleagues stem from the very communities where we work. So that means they're affected by the conflict dynamics just as much as the wider communities where we engage. So a couple years back, we've started to really focus on practicing conflict sensitivity, meaning getting all around the table from the drivers of our project all the way to the project managers and security specialists to look at the conflict dynamics within the communities where we work, making sure that we had a broad representation of gender, origins, political opinions within the room, our greatest wealth being our staff, right? But then we were challenged when the crisis in Ukraine and then Gaza hit, because that practice was made really, really difficult by the conditions our staff were experiencing. So we had to shift the way that we practice conflict sensitivity by taking into account that in some areas, and I'm mostly speaking now of Ukraine and then Gaza, there is no safe space to gather around the table and talk about conflict dynamics. Conflict sensitivity here wouldn't be discussing the conflict between Russia and Ukraine or the conflict between Israel and Palestine. It would be discussing whether we should have Russian-speaking materials for the communities we serve. It would be discussing which family militia is providing security services for which neighborhood in Gaza. And those things are impossible to discuss safely, even for our staff and our partners, in context where there is a daily threat to everybody's lives. So we decided to refocus on enhanced duty of care. And that starts with us, right? So not requiring our colleagues in Gaza to sit on coordination meetings with HQ 3 times a week, or trying to think of psychosocial support that's actually used and adapted to the context. The bet here being that the sooner there is a safe space opening up to discuss conflict dynamics, the better, and our staff and our partners will be better equipped if they've had the care that they needed. And so this decision tree that you're seeing on the left-hand side is one of the latest things that we've developed, and it pertains to digital harm. So we've noticed that our access and security staff, but also our wider colleagues, are exposed to online content being shared on private messaging app or social networks that is violent by nature, and that impacts, of course, their mental health as well, and that increases the overall level of violence within the communities. And so we've developed this tool along with this guidance to help us decide whether we should view a particular violent content, either as a security staff or even just a wider armed violence reduction staff. Not all violent content is needed to make operational decisions on the ground to adapt operations. And so this is just a small illustration of how we've thought of conflict sensitivity and making sure that as we engage with communities, especially in cases of emergency, we take into account how these impact human behaviors and how we can make sure that we protect ourselves and the communities that we serve. Thank you.
Masterfully done in short time. Thank you, Fanny. Thank you to all of our panelists here and in the front, and thank you all for participating.